also 3 HOF buttons to control the blood flow, decrease, increase, stop and stop. And again here we have two buttons. This is for the alarm. In case you have any alarm, you can press here once, like that plus. So after stop the alarm, you can press twice to reset running the blood pump again. And here we have a confirmation button in case if you want to change some of parameters like time, the UF target. The system needs to confirm the new parameters by pressing here in the confirmation. The system also comes here with the heading off as usual, and this is the lock off. Okay. Here we have lamp, it's the heading. And also here we have a holder in case if you don't want to use the heparin, you can have the heparin line. Okay? And like the Dialysis, it can be used by 3 types of syringes, 10, 20 and 30. Okay? 2 pumps. The first one, this is the blood pump. Here.
यहाँ टेबल पर रख देना आराम से.
This is the blood pump.
So the flash आ रहा है.
Disconnect by using here on this one.
जैसे उसमें रखा है
Looking at stainless steel. And here we have the manual crank in case we have any problem. This you can The second one will be the HDF or substitution pump in case you want to use this system for the HDF. By the way, you can use our system by the 3 main types of therapy, which are HD, HF, and HDF. Plus, we have the single needle crossover. But here, it will be different. Here we have some small difference compared with the Dialysis. For the single needle treatment here, we only need 1 pump. No need to use 2 pumps. Okay? We have the 3 pressure sensors as usual, the axis pressure, PS pressure, and again the PPE to make sure all the pressures around or in the extra coercive are monitoring well, and we don't have any problem for the axis. Here we have 2 chamber holder for the single needle crossover in case if you want to use this system for the single needle crossover. 2 online boards, and these 2 online boards we will use it always for priming and re-infusion. So we will save your normal saline solution. No need to use the normal saline for the priming and for the re-infusion anymore. And this is for the regular HD, but for the HDF, even we can use it during the therapy running. But for the HD, we will use it only for the priming and the infusion. In case if we have any hypotension, we have to connect a normal saline here with the IV set to keep it ready and stand by in case if we get any hypotension. 2 sensors here. This is the safety air detector, the usual one, with red detector. Yes, the SAD. And here we have a new of hematocrit sensor. So by our system here, you can check the hematocrit percentage and also the HP. Okay, for this patient.
Sure, it will be accurate result.
Yeah.
It will show.
Yeah. Later I will show you. Okay.
No need to do CBC.
No need CBC. It will save money.
And also, yes, also you can follow the changes. Okay. This one also, we will use it for a special option for our system here called biologic fusion. As you know, to decrease the frequency of hypertension, we can also catch the hematocrit. According to the hematocrit percentage, the system, it will react automatically before getting any hypotension. So in case if we are activate this biologic fusion option, as soon as we are very close to get the hypotension, the system automatically reduce the UF and it will let you know. to take an action.
With alert.
Yes,
Oh.
give you a warning. Okay. Here we have also a chamber holder for the venous. Again, safety detector with the detector and two clamps. This is for the arterial line and this one for the venous. Here we have also the chamber holder for the arterial chamber, and this is the holder for the filter or dialyzer. Here also we have another difference, which is the bicarbonate holder. So you can open it and close, and here we have a bottleneck, so no need once you are too new to connect this machine, no need to look down. Okay, we will concentrate the bicarbonate by touching the bottleneck. Okay, so the connection will be also too fast and very easy. Here on the machine, again we have here the rinsing bridge and with two couplings. The blue one as usual for dialysate inlet, and the other one for the dialysate outlet, the display dialysate. And again here we have the sampling port to collect the water sample in case you want to collect any water sample. In the back wall of the system here we have the holder for the citric acid of 50%, and here instead of the box here we will get two dialysate fluid filters here, and as usual we can use up to 150 treatments or 900 hours. Yes, and here the door it will be more organized and too fast to open and check. Okay. And this is the handle of the system. IV board, as usual, to hang the normal slide. On the other side, or in the back of the screen, you can see here we have the basket to set the typical, instead of here, in this area, we can sit here. What else? And here we have the patient therapy card actually. Yes, instead of here in this area, we can see also up to 150 therapies by using the patient therapy card. But as you know, the most important thing, you have to activate, of course, the therapy. What else here? Also, we have the concentration rods. Okay. The red one is for the acid concentrate, and the other one, this is for the bicarbonate, in case if you want to use the bicarbonate instead. And the most important thing, you can take it from this handle and connect to the canister. No need to rotate like the other machine, just pull it out. Okay? Here also, we have a new option, which is the leakage sensor. So in case if we have any fluid leak from the outside or the inner side of the system, the fluids will be collected here in the machine base, and by collecting up to 200 ml, the system start to give you alarm. Yes, fluid leak sensor. So the most important thing, keep always this area it's dry. And in case if we have any fluid, the only thing just you can bring some of tissue or syringe just to make it dry. This is the sensor. As soon as we dry this area, we can reset that up. Also, the system coming with 4 big wheels and brakes as usual. And regarding to the weight, I think this machine coming with 100 kg. Okay, I think the movement is lighter than the plus. Any question until now? Question, guys? Okay. Now let's have a look on the screen and the user interface. As soon as we mentioned before, in case if you want to start a new therapy, the only thing just you have to press here, yes, to switch on and switch off. So to switch on again, we need to press here, short press, up to 3 seconds. Then you will get this main screen, which is called program selection screen. Here, regarding to the user interface, it will be more organized. That means here, as you can see, we have 6 different screens comparing with the Dial Plus. If you remember, for the Dial Plus, we have here in this area, we have a lot of icons. Just you have to press to get a new screen. But here, the system comes with 6 different screens, which start by program selection screen. And here in the program selection screen, you can check, you can find four words here. So this is for the HD double needle therapy, HD single needle, HDF double needle, and here this is for the disinfection. Okay, this is the first one. Now to go to another screen, here we have 2 arrows, and you can see this screen coming based on the yes, like this one. So suppose here, if we open this faces, we will get 6 slides, like this one, like this figure. Okay, so you can see the green lights here, means we are still in the first screen. If you want to go to another screen, just you have to press here on the arrow. Now we will get another screen, we call this one home screen. And in the home screen, you can see here we have a lot of icons, okay, in terms of the UF volume, the time, the final conductivity, and the priming volume. And this is for the blood pressure. And you can see now the color is shifting to the second square, okay? Now, and also it's mentioned here, there is a word. So to go to the input screen, as it's mentioned here, you have to press in this arrow, or you can swipe in this area. Now we are in the input screen, and in the input screen here we have a lot of icons. Still now it's not active because we still not start any preparation, but it will be started once we start the preparation. It will be active. To go to the last one, which is the setup, you have to press the last one, and here in the setup, you can control the brightness of the screen. Also, the alarm sound, so you can decrease or decrease from here. So the default will be on 60, and you can increase up to 100% or decrease from the setup screen. In case if you are using the patient therapy card, you can save the data from this square, but now it's still not active. And this is the date, time, the language, to check the filter status, I mean the dialysate fluid filters from here. And this is for the disinfection history. Also, you can check the disinfection history from this. Now, again, also here we have a shortcut for the home screen, so no need to go back one by one. As soon as you touch here, you will go to the main screen, which is in the middle. So we can move horizontally up to 4 options. And in case if you want also, still we have 2 vertical screens, but the most important thing, before going to the up or downward, you have to go to the home screen, to give you a chance to move up and down. But in case if you are in the input screen, look, we cannot. So always you have to go to the home screen. Now, you can press here to check all the patient data. We call this one the info screen, the information screen, okay, which is same to the overview icon, if you remember, the icon in there plus. So yeah, by pressing here, you can check the protocol, the TMP, the heparin stop time, the single book, the auto-sat of the patient, total blood volume, the heparin volume, total substitution volume. In terms of the adequacy, you can check the anemia, the hematocrit, the history of the therapy, and here by pressing on the history also, you can change the parameter, whatever you want to check. So the default here, average blood flow, I want to check, let's say the URR. By pressing OK, you will get a new curve for the urea reduction ratio. Okay? And even here also. Okay? This is for the today or the current therapy. Clear, guys? I will press home screen. This is the time. Here also, this is a lock. So by pressing here again, the system will give you 10 seconds just to freeze, yes. Like this. Yes.
Aywa.
Okay. Now I will go back again to the program selection screen. Also here we have this icon for the reminder. So by pressing here, you can go in case if you want to set any reminder during the therapy running. For example, I want to do flushing, yes, or dressing for the catheter. So you can set the reminder here. But still the reminder, the timer is still not active because still we will start the preparation for your therapy. And the last one, which is coming with the question mark, this is the help icon. So in case if you don't remember any icons, you can press on the question mark to give you more details about the icons. Okay? Okay, so as soon as you switch on the machine, you will get the main screen, which is the program selection. And this is the time now to choose what do you want to, or what's the plan for the doctor send you to start. Let's start with the HD double needle therapy. By pressing here now, the system starts the preparation. And as you can see here, the system also starts to give you an instruction to connect the bicarbonate canister or cartridge and connect the acid concentrate. Now this is the time to connect. Sorry?
I think we should be turn off this light.
Questions?
It will be more clear because there is a
And
flash
now
light.
we have to connect
Reflection.
bicarbonate. So for the connections, yes, you will start from the
Yeah.
downside
It's good.
and
Good.
connect here. Okay? To unload. Okay? You need to make hard pressure here. Okay? Now it's connected. You have to make sure it's connected. Okay? Okay. Now the preparation started, and you can see here we need only 16 minutes for the preparation.
How many minutes?
16.
Minutes.
Yeah.
At this time I can prime.
The priming, including the priming and everything, within 16 minutes, you will finish everything. Okay? The self-test, including the priming. Okay? Now the preparation starts. Now here, in the service, is the last screen. We have the service screen downward. You will get now the self what indicators here. This is for the BF side pressure. This is for the alarm, the sound exit, the battery, the puzzle, voltage. So the system coming one by one. Now, in the first preparation, the system needs 60 minutes. For the second preparation, it will be less than 16 because some of these steps it will done only one per day. No need to repeat for the second shift. Okay? Okay. Now, as soon as you start the after connect the acid and the bicarbonate, immediately now you can start install the filter and line. Yeah. This is the filter. Now we can connect. Here. And this is our new HDF line. We will use this one only for the HD, which is including this. The only difference, including the the substitution line.
If HDF, there is this one.
Yeah.
But if HD,
We have only this one. Okay. As it's mentioned here, HD.
okay.
Okay. The filling volume for this line is up to 125. Okay. Now, I will remove this part. No need to use it. Okay. And I will start to connect the lines. Before starting to connect the lines, guys, could you please come here to this node? So, usually we will prepare the system as online. I mean, we will use this substitution option to prime our system. Now, in case if you want to use the regular one by normal saline, you have to change some of software option inside. Okay.
Probably with software.
So yeah, you have. It must.
Only the program, not only
Yeah.
the software we will
Yeah.
change.
So you will come to the blood side parameters, and or even let me check here. Wait. By pressing the priming volume, yes, the priming. So here, the priming method is port to port. Means we will get the solution from here and drain it from the other side. Now, in case if you want to use the bag priming, it must to choose bag to waste port. If you don't change the system, it will not pass and give you self-test failure. Clear? So you have the only thing, just you will come here, you press on the priming volume, and you will get this screen, and just you have to change from here.
Priming.
Yeah. Now we will keep it as port-to-port priming. Okay? Yeah. Clear, guys? Questions? So how we can get again? Just you have to press
Priming
this
volume.
corner with the priming volume and change from here. Clear?
Port to port.
Yes. Keep it port to port from the beginning. So you cannot change it during the priming.
Before priming.
Yeah, you have. So in case if you forget it, you have to stop the preparation from here. Again, repeat. Choose another. Again, choose the therapy. Let me show you. Now stop the preparation. The system go to the main screen. Again, I will choose here. Press here and come in here. Change to, let's say, back to waste port. before start the blood pump running.
Again.
Clear, guys? Any questions? Okay. So now again I will come and make it portable. Okay. So no need, in case if you want to stop the preparation, no need to disconnect the bicarbonate or the acid. Keep it as it is. Okay? Now, we will start the initiation for the lines and filter. Now, if you can check the figure here, also during the planning we have to keep the filter in horizontal way to make sure 100% there is no any air will be remaining during the priming, and no need to tap this on the filter. Okay, keep it like this. Now I will start with the pump segment, and this is the most important thing. You have to take a look and concentrate, please, for the connection of the pump segment. Also, we need to connect this part horizontally, not like this. Okay, keep it like this. This is the heparin pump, and you can see this is the parking position of the heparin pump. Yes. Now, if I try to move it like now, again it will rotate and go back to the same direction. Okay, so here we have an automatic loading for the pumps. So to connect, this is the heparin line port. Keep it always outside, and you have to insert this part totally to the end. Okay, look, you can see sister coming from here. There is no, make sure there is no any gap, like now. Okay, should be inserted totally, and just you have to rotate and press. Okay. Now, as soon as you close the pump, it will take the pump segment automatically. But you have to make sure it's connected properly. Okay? Like now. Now it's connected. Now, if you can see also here, come on sister. Also here we have an empty space. You can see this chair. So to unload, even you can unload automatically. Come on sister. You can see in this door, in this part. To unload automatically also, just you have to keep your hands here to fix the door and move this part. Yeah. Again it will rotate. And
push
this
back.
one. Yes. To push back and take it. Again. And this is what we want to train before start the patient connection.
Push
Push and
forward
close.
and then push back.
Yes. To unload, keep your hands here, because if the door will open, it will interrupt
Yeah.
the installation. Now it will take. Clear, guys? So,
Automatic.
why you have to connect horizontally? Because if you try to connect like this, sometimes you will get some of. Yes, and if you now close the door, it will not rotate.
It will not rotate.
Okay? So, the better way to look like this and repeat.
Madetect niya pag hindi nakapasok.
Because here we have a sensor.
Yeah.
Okay? Now this is the heparin pump. I will keep it here, as mentioned before. And again, also for the heparin pump, this is the normal position, the normal vacuum position for the heparin. It should be always in the middle. Why? Because during the self-test, also the system tried to check this part by moving. So if you keep it like this, you will get a self-test failed for the heparin pump.
So
Yeah, should be like this, and make sure this one is locked. Even if you keep it open, it will not pass the self-test. Okay? So now this is for the evening, for the arterial line. This is the arterial chamber. It should be also connected in the opposite,
Okay.
like this. Here we have the transducer for the axe pressure. Look, it's very close to it here. Just you have to remove the cap. Keep the line passed here. And to connect by the clamp, just you have to press here and insert. To remove, only use one hand, push and pull.
Okay.
Okay? Now, you can hang, also here we have a holder for the lines. You can hang the lines here. So, we have the transducer for the PPE. Should be connected. And look, it's very cool to connect here. The most important thing you have to connect these parts, I mean the connection should be tightly connected to avoid any leakage pressure in this. For the second line, yes, I'm sorry. And for the arterial line, it should be now connected with the filter. And you can connect in this way. You check the figure, look, the arterial line, it will be here. Now for the venous, it will be as usual. There is no any difference. You can connect here. This, and connect now the filter. And this one now you can connect. Okay guys, this is regarding to the connection. Still, I have that one for venous, and also we have the color coded, so it's easier for you to connect. Now, the blood lines and the installation for the lines and the filter is finished. Do you have any question? Until now. Oh, very good. Now, as soon as you get these instructions, now this is the time to open this online board to connect the line. But before this instruction, you cannot. Please, you have to wait until you get this, yes, this instruction. At the beginning, you have to wait only 2-3 minutes. After that, you will get this instruction. Okay? And you can see here,
Prepare.
this complete setup. Okay. And also, running this complete setup. Okay. Let me check now. Okay. Now, the instruction here, mount the dialyzer and connect the coupler. Now, also immediately now, you can connect the coupler. No need to wait like the Dial Plus until get the message. So this is the time now to connect the coupling. Open the waistboard, mount the venous blood line and connect patient into waistboard. So this is the venous line. It should be now connect according to the color coded. This color. Open the substitution port, mount arterial line and connect to the port. And now we have connect. So just you have to press here by your thumb and open it. Connect the arterial. As soon as you finish, now this is the time you can see the priming icon start blinking, means now the machine is ready for the prime. Okay? Yes. Now, before start priming, I will ask you guys, please, you have to load all the unused clamp, as we have 5 clamps. So this is for the HDF post-fusion, should be closed. This is for the venous chamber, sorry. This is for the pre-diffusion, IV pool, for the IV pool, IVC, and the last one is for the brain pump, which should be closed. So we have 5 clamps, 2 in the venous line and another 3 for the arterial line. Plus you have to do a double check for your connection, for the pressure sensors and the filter. As soon as you finish, now this is the time to press back. If you press on the surface now, you can see it's filled with the white color, means
Priming.
it's done successfully. Yeah.
Okay.
Suppose I will keep this one open, just to show you what will happen for once we reach for the heparin pump speed. Okay? Now, as soon as we start the priming, now we will start to get the fluid from here, sent it by the blood flow to the chamber. And regarding to the chamber filling, no need to do anything. It will be done automatically by the system also. So the only thing, just you can press priming and leave. We have still 7 minutes. Okay, guys? Questions? So even for the level adjustment, it will be done automatically by the system.
So, minus na tayo ng sa
Kahit yung sa old machine, sir, kapag slide lang sa after na forward option.
Pwede mo mag-in yung
Any question, guys? Until now?
Pwede mo.
So you can see when the system start to make a positive pressure inside, just to remove the whole air without it on the filter. You can see it's closed and open.
So, the machine also is the one controlling the blood flow?
Yes,
When
yes,
priming?
yes.
Ah,
No need
No need to increase, no need to decrease.
Yes.
300.
This is the priming volume.
Aye.
You can follow the priming volume. So again, we can start by 700 and start to count down until reach 0. So now you can go to the input screen by pressing here, as I mentioned before, or by split in this space, or by touch these icons. So in terms of the final conductivity time, now we can set the patient parameter.
And you add volume.
Yes. The therapy, the UF volume, the UF rate is for in terms of the UF. And you can see here we have a lot of parameters which is coming under input screen. Okay. In terms of the exit fluid. So this is for the parameters of VF in terms of the conductivity, the bicarbonate conductivity, the exit temperature,